The alarming resurgence of measles in the United States is not just a health concern, it's a wake-up call we can't ignore. While one deadly outbreak in Texas finally subsided in August, new flare-ups are popping up across the country, adding hundreds of cases to this year's already staggering total. But here's where it gets controversial. Some are questioning whether our response is truly matching the severity of the threat. And this is the part most people miss: the connection between these outbreaks and the declining trust in vaccines. According to the latest data from the CDC, an average of 27 new measles cases have been reported each week since August, pushing the annual total to 1,563 cases since January. This is the highest number by a wide margin since measles was declared eliminated in the U.S. a quarter-century ago. A situation is unfolding with new outbreaks in Ohio, a sudden surge in Minnesota, and over 150 unvaccinated school children in South Carolina placed in quarantine due to ongoing outbreaks. Historically, the U.S. had only recorded 10 large measles outbreaks, defined as more than 50 related cases, since 2000. Yet this year alone, we've already seen 3 such outbreaks, including one along the Arizona-Utah border that's already logged over 90 confirmed cases and continues to grow. Dr. Leisha Nolan, Utah's state epidemiologist, warns that the virus still has plenty of room to spread. Unfortunately, I think we still have quite a while to go with infections, she notes. We're starting to see people get infected even at the very north end of our state, so I suspect we're in the middle of it. Experts stress that any measles transmission is a red flag, especially when large outbreaks highlight the dangers of falling vaccination rates. When you have multiple cases happening, particularly with those numbers, it's only possible because you have susceptible individuals, explains Dr. Scott Harris, president of the Association of State and Territorial Health Officials. He points out that while measles cases do appear in the U.S. every year, often brought in by international travelers, they only explode into outbreaks when they encounter unvaccinated communities. The Texas outbreak serves as a stark example, with state health data showing that 97% of cases involved people who hadn't received one or both doses of the recommended vaccine. The story here is, parents of young children are skeptical about vaccination, Harris says. There are lots of reasons why, but if that weren't the case, this wouldn't be a story, because we wouldn't have these outbreaks. This skepticism is reflected in vaccination trends. The CDC reports that a record share of U.S. kindergartners had exemptions for required vaccinations in the last school year, and overall vaccine coverage, including the measles vaccine, has been on a downward trend for years. The latest data shows MMR vaccine coverage dropped to 92.5%, falling short of the 95% threshold needed to prevent measles spread. This marks the 5th consecutive year coverage has been below that critical level. In Utah, public health officials are using wastewater monitoring to track measles spread beyond official case counts, identifying areas with low vaccination rates where the risk is highest. In those areas, we try to work with the local health department and the community to get the word out that we know that there is measles in their area and that we really encourage families to consider getting vaccines, Nolan says. While misinformation has fueled vaccine hesitancy, she adds that vaccination rates have started to tick up as awareness grows. Meanwhile, South Carolina is battling another outbreak that could escalate quickly. Over 150 unvaccinated children are in quarantine after measles exposures at 2 schools in Spartanburg County, which has one of the lowest school vaccination rates in the state. Those schools are following the protocols to exclude these students until the period of potential disease transmission has safely ended, says Dr. Linda Bell, South Carolina's state epidemiologist. With about 90% of exposed, unvaccinated people likely to become infected, the stakes are incredibly high. The human and financial toll of these outbreaks is immense. It's incredibly expensive and demanding for local health departments to respond to measles threats, says Dr. Caitlin Rivers, an epidemiologist at Johns Hopkins. Health departments are already stretched thin by budget constraints and staff attrition. Adding measles outbreaks to their workload is draining the reserves of even the best resource departments. Even with the federal government shutdown, the CDC has continued to update its measles tracker, but some worry that response times may be slower than usual. We're in the midst of a measles epidemic, warns Dr. Paul Offit of Children's Hospital of Philadelphia. We should have an administration that stands up clearly and definitively and holds press conferences saying, "Vaccinate your children. These are preventable illnesses." Yet, trust in federal health leadership has waned, with polls showing most Americans disapproving of the way Health and Human Services Secretary Robert F. Kennedy Jr. has handled vaccine policy. So here's the question we all need to grapple with. How do we turn the tide on this alarming trend? Is it enough to simply provide more vaccines, or do we need to address the deeper issues of trust and misinformation? Let's hear your thoughts in the comments. What solutions would you propose to protect our communities from measles and other preventable diseases?